Hi, this is Sangeeta Dhavla going to take you through the topic living with diabetes, nature, psychosocial dimensions and helping people cope with diabetes. The main objective of this lesson is to focus on what diabetes mellitus is all about. Another objective is to focus on the various psychosocial dimensions of the problem, and yet another objective is to focus on those coping skills that will help the diabetic to lead a comfortable life. There are various psychological and biological characteristics that conflict between the ideal and the achievable in coping with various life situations. In diabetes, this is mainly because of an imbalance that exists in the metabolic system of the person. There is an apprehension of disability that causes economic hardship and also fear of early death. Management of diabetes calls for a lot of care and a lot of restrictions in the dietary routine. Individuals with diabetes mellitus have lived well so far with fewest complications, and the best controlled were those who were centered in their management of active lifestyles around good health habits, regular exercise and strict adherence to their dietary regimen. Therefore, it is not only the disease that contributes to the complications, but also the patient's ability to accept this discipline into his day-to-day activities that will decide the future of the patient to a great extent. There is a lot of self-discipline that the patient needs to show in order to have a normal life, but though management of diabetes calls for a lot of self-discipline. We know that there is no cure for diabetes, but it is definitely treatable and can be kept very much under control. Diabetes is one very personal disease, and hence it is very important for the person to get a thorough understanding of how he could manage the disease on his own, rather than depending on the doctor every time, or rather than depending on his spouse or mother all the time. What is diabetes mellitus? What is the nature of this disease? Let us first understand that before we actually get into the various psychological and sociological components of the disease. What is diabetes mellitus? In diabetes, the body cannot metabolize food substances properly because there is little supply or no supply at all of the hormone insulin. Insulin is produced by the pancreas, a gland that lies behind the stomach. Normally, the pancreas releases insulin in proportion to the glucose level in the blood. In diabetes, there is a mismatch between the requirement and the availability of insulin in the body. In general, the insulin helps glucose to enter the body cells, providing them with the required energy. It is also involved with the storage of reserve supplies of glucose in the muscles and liver. These reserves are stored in the form of glycogen, which are restored and converted back to glucose whenever the body feels the necessity. Insulin is found to regulate the amount of glucose that circulates in the body and the bloodstream and prevents it from rising above a certain range. We understood that diabetes is a metabolic disease where carbohydrates are not effectively utilized. Much of the glucose stays in the bloodstream rather than being metabolized or stored, and the body does not get the kind of energy that it should get. What are the different types of diabetes that we know of? There are basically two types. They are called the insulin dependent diabetes mellitus and the non-insulin dependent diabetes mellitus. What is this IDDM or the type 1 diabetes mellitus? This is a condition where there is absolutely no insulin developed or produced in the body. This condition generally affects the children who are around 9 to 15 years of age, and that is one basic reason why we refer this kind of a condition also as juvenile diabetes. In this case, the parents will have to take active role in trying to help the person or the child cope up with his condition. Type 2 diabetes mellitus, this is the non-insulin dependent diabetes mellitus, which is found to affect the middle aged people and the old age group people commonly. In the type 2 diabetes, we will find that there is insulin resistance or insulin inadequacy in the body of the person. Especially the type 2 diabetes calls for a combination of lifestyle modification and drug usage. Being so common and needing continual attention, this often results in a lot of problems as far as compliance with the dietary regimen as well as the medical regimen is concerned. The body produces a lot of insulin, but the cells do not have the ability to make use of the insulin that is produced. Although it was once common in older adults, its occurrence has now become very frequent. The major risk factors for people to getting this diabetes mellitus, the type 2 category, is inactivity, lack of exercise, obesity and genetics. Diabetes has in fact become a worldwide epidemic. Why is it so? Why is there such a huge incidence of the condition? It boils down to the sedentary lifestyles that majority of the people are leading. Either they sit in front of the televisions or sit in front of their computers. Even the kids for that matter are so stuck up with indoor games that they hardly get out and get some kind of a physical activity. How do you know that you have fallen prey to this silent killer disease, diabetes mellitus? Well, we should be aware of the different kinds of symptoms that it slowly sets in. First of all, excessive thirst. When there is a lot of buildup of sugar in the bloodstream, the fluids are absorbed from the tissues. This will leave the person thirsty. Next symptom is excessive urination. As a result of this thirst, the person drinks a lot of water. As a result, there is a lot of urination. Excessive hunger. When the insulin is unable to move the sugar into the body cells, the organs are depleted of energy. When the organs are depleted of energy, the person will obviously feel hunger. So, whenever there is excessive thirst, there is excessive urination or there is excessive hunger, you can consider that these are the warning signals of the dreaded disease, diabetes mellitus. In addition, there may also be fatigue, there may also be blurred vision and slow healing of infections. So, it is not only infections, for that matter there may be a cut on your body and it generally takes a very long time to heal. So, if at all there are these symptoms in a person, it is time for him to visit a doctor and get it confirmed that he has fallen prey to the disease. What is the cause of diabetes mellitus? We have discussed earlier that type 2 diabetes basically sets in because the body gets resistant to insulin or there is no production of insulin in the body at all. Excess weight and inactivity are found to be the most important culprits for falling prey to this disease. Glucose, which is a sugar and the chief source of energy for all the cells, come from the food we eat and also come from liver. This sugar is absorbed into the bloodstream and then into the cells with the help of insulin. The liver, we discussed just now, stores glucose and also makes glucose. When the body has low levels of insulin, the liver has the ability to break down the stored reserves into glucose and maintain the energy levels in the body. But this mechanism is not proper in those people who are suffering from type 2 diabetes mellitus. Instead of the glucose moving into the cells, the sugar levels enter directly into the bloodstream. As a result, the sugar levels are shot up. What are the various risk factors of diabetes mellitus? Weight. If you are excess in weight, you definitely stand a chance of getting or rather falling prey to diabetes. When the fat is primarily stored in the abdomen region, the risks are found to be higher than when they are stored in the hip or in the thigh region. Lack of activity definitely increases the risk of getting diabetes at one stage or the other. In case of family history too, the person stands a very strong chance of getting it. Especially when the parent or the sibling has the condition, you can rest assured that even you will contract the condition at some point of time in your life. Age. Age is another risk factor. Older the person is, higher is the chance that they may fall prey to this condition, especially type 2 diabetes. But when you take care of your own self, when there is lifestyle management in proper place, you can rest assured that you will be very far off from falling prey to this disease. Pre-diabetes condition. This is a condition where the person cannot be diagnosed as suffering from diabetes, but he is a borderline case. Certain amount of laxity in his dietary habits or exercise habits will definitely put him in the diabetes category. Therefore, one should always be vigilant and get periodic checkups done so as to ensure that they have not fallen prey to this disease. What are the complications that may set in once you fall prey to diabetes? Well, this is called a silent killer, but once you get it, you will have to keep it under control, otherwise your bodily condition is going to go haywire. Not only will you be more susceptible or vulnerable to diseases, other diseases like hypertension, heart disease, cancer, nerve damage and many other such conditions. What are the kind of complications that may set in when you are not careful in managing your diabetes? Well, when you do not take good care, proper care of your own self, there are a lot of complications and they do spell a lot of danger. What are they? They are diseases related to the heart and blood vessels, they are diseases related to the kidney, diseases related to nerve damage, foot damage, eye damage and hearing impairment as well. What are the various psychosocial dimensions of diabetes mellitus? We have understood by now that diabetes is a condition which is going to remain with us. It is a chronic disease for sure. There is no permanent cure for this disease, but it is only clever management that can put you through the disease successfully. So, what do you have to do? It is a lifelong management. Not only lifelong, but before that you have to look into a daily management schedule of the condition, so that you will be able to function better and perform your duties in a better manner, like in the manner you used to do earlier. We see that the psychosocial factors are interwoven in almost all aspects of the individual's functioning with diabetes. First of all, his understandings, his beliefs and his attitude towards the disease and towards his own self will take a huge beating. There is a lot of stress related to his own condition and related to the disease. A person, when he knows that he is diagnosed with diabetes, initially may be confused to no extent, but when he sees that there are so many others managing well with the condition, he gains a bit of confidence and then he also works in the direction of gathering as much information as he can regarding the disease. Better choice of coping skills and good social support also will help him deal with the condition in a better manner. One thing that he should realize is that he should adhere strictly to the entire dietary regimen as well as treatment regimen. This adherence is going to influence his condition in a very long way to go. The diabetic individual's quality of life is marred. He cannot behave. The quality of life of the diabetic is marred to a great extent. Of course, there is nothing to lose heart in this, but with the clever management of various options that he has got, he can very quickly regain his earlier quality of life. Sexual dysfunction is also going to be one of the consequences of his condition if he is a person suffering from type 2 diabetes mellitus. The fact that the person has been diagnosed with type 2 diabetes itself can prove to be a great stressor. Now, how can this kind of stress be released? First of all, the spouse should be extra careful in what he or she is talking to the patient. This stress that the patient feels is not restricted just to himself, but the spouse also may be equally stressed if this happens in a couple. But if it is the elderly person that has been diagnosed with diabetes, the other family members also should be supportive enough and suggest him ways in which he can control his condition. There is always a risk that people may be stigmatized by their close friend circle or relative circle. Therefore, it helps in a long way for the patient as well as for the support system of the patient if some bit of information about the disease is shared with them. People have to make a whole lot of adjustments when they fall prey to this condition. It is more or less a customary ritual that they need to perform with themselves if they have to keep their insulin levels, glucose levels under control. This condition brings about a lot of bodily changes. It is because of these bodily changes that the diabetics do not feel confident as they were in earlier times. It is because of this condition that they draw out of certain activities. It is because of this condition that they do not take active part in various social activities too. The response of the family to the disease definitely has a great impact in how the patient will deal with himself and how he will adhere to the treatment regimen. How can we help the diabetics lead their life comfortably and normally? How can we help these diabetics cope with the challenges that diabetes poses to them every day, every month and throughout their life? There is a whole lot of information that is available. First and foremost, it is your doctor who can give you all relevant information related to your disease. If your doctor does not have the time, then you can turn to the self-help groups where you can find many people like you also sailing in the same boat. You can find people who are more experienced than you in tackling the disease. You can also take the help of the internet that can bring you a whole host of information with the click of a button. There are so many techniques available that will help you improve the quality of life, both short term as well as long term. But unfortunately, these techniques are readily available only for the urban population. What happens to the rural population who is also equally prone to this kind of a disease? It is the awareness programs that need to be conducted at both the rural levels as well as the urban levels that will bring about more awareness regarding the techniques that are available to manage diabetes. Diabetes comes with demanding routines of care, and the demand is very high when the person is dependent on insulin. If the person is dependent on tablets, it is okay because he can carry them wherever he goes and he can just pop it in once he is done with his lunch or supper. But if it is insulin that needs to be administered, he needs to stick to the timing perfectly. The symptoms have to be managed so well that they do not get awry and the person does not have to succumb to one of the after effects of this disease. As a result of such a stringent process of care that he needs to follow each day, day in and day out, there is a lot of stress on the person, as a result of which his physical well-being is challenged. There is a lot of necessity to offer him the right kind of psychosocial intervention strategies that will help him resolve a lot of these conflicts. Studies have shown that people showed slight emotional disturbances after being diagnosed as a diabetic. The parents or spouses of the diabetic also were clearly distressed for a certain period of time, but diabetes education has definitely or will definitely help the patient as well as his caretakers to tackle the disease in a more confident manner. The main challenge is to restore the emotional equilibrium. When the emotional equilibrium is restored, the person feels optimistic about his own condition and will feel motivated to stick to his dietary as well as exercise as well as his treatment regimen. The main challenge is to explain to the patient as well as to the support group how important, how necessary it is for the patient to stick to the treatment regimen. When you religiously abide by all those instructions that are given to you by your endocrinologist or the diabetic specialist, you can rest assured that you will lead your life pretty normal. What are the various medical complications that might set in once you are diagnosed as a diabetic? There may be visual impairment, sexual problems, coronary artery disease, kidney insufficiency, peripheral vascular diseases and various other complications. Sexual dysfunction. This may be one debilitating factor psychologically on the minds of the diabetics. There is erectile dysfunction, where the man is unable to experience his sexual life like he used to do earlier. It has been found that 50% of the men with impotence problems have problems like stress, depression and anxiety, which contribute to this erectile dysfunction. Women with type 2 diabetes were also seen that they were not getting aroused so frequently, they did not reach the orgasmic point, or they did not feel an urge to have sex. This is the kind of effect diabetes is going to have on the sexual lives of the people who have fallen prey to diabetes. So, lifestyle diabetes self-care can definitely help in bringing back certain amount of normalcy into the sexual lives as well. Eating disorders. People with diabetes are more prone to developing eating disorders. Eating disorders set in because there is a lot of confusion about what to eat, what not to eat, the calorie intake, excess of it or less of it, and then so many other things like purging. All these things leave the person confused, and as a result he might just engage in binge eating and his entire weight issues remain the same. Or at times it may result in weight loss also, because he is being really very strict with himself. In order to manage such kind of a condition, the diabetes treatment team also has to routinely discuss the importance of taking quality food and the right amount of calorie food. There are psychophysiological and behavioral approaches that have inspired different types of interventions for people who are suffering from diabetes. Coping skills training is found to be highly effective in making the person deal with his condition in a successful manner. There are numerous studies that have also established the fact that presence of diabetes just does not affect the emotional well-being and behavior of other members of the family, but it also, numerous studies have established the fact that presence of diabetes affects the patient, but it also affects the immediate circle of people who are with the patient in terms of their emotions as well as their psychological well-being. Poor family functioning will definitely bring out only poor management of diabetes, but in a family where the functioning is smooth, one can rest assured that his management of diabetes will also be very, very smooth, and he can lead a pretty much active life. Therefore, family therapy is found to contribute greatly towards effective management of diabetes. The very immediate people associated with the patient need to be explained the importance of the treatment. First of all, they need to be explained what diabetes is all about and how it can be managed. When the patient gets support and understanding from his immediate members, there is all likeliness that he will understand the severity of the condition and then abide by the entire program without failing at any stage. It is essential that the diabetic clinics also understand the importance of such psychological interventions and have someone qualified to deliver such kind of counseling to the patients. Patient counseling is essential, and family counseling also becomes highly essential if the person has to tackle his condition successfully. Therefore, when a person is diagnosed with diabetes mellitus, it is not only his diet, his exercise and his treatment that are to be taken into consideration. He needs to be educated well in the area of diabetes so that he stays informed of what might happen in case the condition is not taken care of. At the same time, the people who are related immediately to the patient also need to be informed of the various complications and consequences that might set in with diabetes. With the right amount of education about diabetes, with better coping skills and family therapy and the right kind of psychological interventions, diabetes is a condition that can be managed extremely well, though not cured.